Today we're going to be discussing patellofemoral pain, or more commonly known as runner's knee. Runner's knee, or patellofemoral pain, is pain that's often experienced in the patellofemoral joint, and that is a connection between the femur, or the long bone of your leg, and the patella. The patella is a sesamoid bone that acts as a pulley to increase the amount of force produced by your quad. And oftentimes we can have some pain that is experienced behind that patella, which may leave you asking yourself, am I experiencing patellofemoral pain, or am I experiencing something else, such as arthritis or a meniscus tear? When patients describe their symptoms of patellofemoral pain, it's often described as a sharp feeling right underneath the kneecap that gets worse when doing activities such as going upstairs, running, jumping, squatting, and any other activity that loads the patellofemoral joint in a bent knee position. Arthritis and meniscus tear can be a more deep feeling, kind of more like it's in the joint itself rather than on the surface. Arthritis pain tends to be very cyclical, meaning it will get better and then it will get worse with time and the activities that you're doing. A meniscus tear oftentimes comes on after an event such as a twist or a fall with a planted leg, and it usually comes on pretty quickly rather than something that comes on slowly like patellofemoral pain. When I get messages and questions from friends and family about their knee hurting when they begin to run, oftentimes it's usually when they had just increased their mileage by a lot when they're planning on training for something and they hadn't really been very active beforehand. If you don't use something for a very long time, those structures are a little bit weaker and they're not as strong in order to handle the load that you're all of a sudden placing on it. So when you go from not running for 6 months to running 4 miles every day, the knee isn't prepared to experience that load because it hasn't had to do that for months. So an important part to treatment and management is noticing the load that you're putting on the knee and then trying to cut back or manage that in a different way, modify activity in order to decrease that load so that we can have some healing and then we can build it up and get it stronger. So what exactly causes patellofemoral pain? There's a lot of disagreement about this in the literature, and I think it's important to recognize that we aren't exactly sure what the true cause of patellofemoral pain is. However, we do have some correlation with strength of the quad and the glutes and the hip musculature. So this is what a lot of physical therapy treatment is going to be surrounded by. Level A evidence suggests that strengthening of the quads, the glutes, and the external rotators of the hip are going to be some of the best treatment and at the forefront of what you can do in physical therapy and what you can do going forward in order to increase the strength, increase the load management and load tolerance, and start to getting back to doing the things that you're going to be doing. So let's start with some exercises that we can do here now.
The first exercise is standing hip abduction. It avoids placing unnecessary strain on the patellofemoral joint while targeting stability in the hips and the gluteus medius muscle. The goal is to keep the ankle, knee, hip, and trunk in a line to avoid leaning too far to one side or the other. It may be best to start this exercise without a resistance band to get down the form before moving on to resistance. Here's an example of form to avoid when completing this exercise. Trunk lean facilitates the motion with the whole body rather than the hips and gluteus medius that we are attempting to target. Pointing the toe outwards rather than forwards changes the primary activation to the hip flexors and TFL, which is not the goal of this exercise. Although we are actively moving the right leg in this video, most of the work is being done by the stationary leg. You will feel a burn in the side of your hip when performed correctly. Standing hip extension is very similar to the last exercise, and we follow the same rules during. This targets the gluteus medius on the stationary limb by stabilizing the hips and core. It targets the gluteus maximus and biceps femoris muscles on the moving limb. Side plank is a great exercise for core stability and gluteus medius activation. Similar to the standing hip abduction, the stationary leg is doing more work than the moving side. This is why it is important to do these exercises on both sides of the body. The key in this exercise is to maintain a straight line from the ankle up to the core. A clamshell is a starter exercise for activation of the piriformis and deep rotators of the hip. Although not very functional on its own, it serves as a muscle memory exercise for when we ultimately add this motion to a squat. This exercise can be made more difficult by adding a side plank to activate the opposite side of the hip, similar to our side plank with hip abduction. A band-resisted squat is a great compound exercise for lower extremity strength and stability. It may not be tolerated in acute flares of patellofemoral pain, and it can be altered by changing the depth, speed, and limiting forward translation of the knees over the toes. The most important aspect of this exercise is pushing out against the force of the band to activate the glutes and external rotators of the hip. Let's look at a less controlled squat with some obvious breakdown in form. Here you see the knees start to cave in towards the midline on the descent, which is a clear indication of weakness in the hips and the external rotators, but not necessarily the quads. Now let's compare that form to the form seen earlier, which is much better. On the left, you see that the knees push out against the band through the descent while keeping the knees in line with the toes and the hips. On the right, the knees collapse towards the center and results in an unstable descent that may possibly be contributing to patellofemoral pain. This exercise is a step down from a squat and can be performed if a squat is too irritating for the knee. It activates similar muscles while also having more engagement from the core muscles such as rectus abdominis and transverse abdominis. It is important to drive up through the glute rather than attempting to arch your back to facilitate the movement. A band-resisted bridge can act as a stepping stone to a band-resisted squat if it is currently intolerable. It works similar muscles to the squat while decreasing the amount of stress placed at the patellofemoral joint. This exercise should be pain-free before moving on to a squat, but I placed it after the squat to this video because if you are able to complete that exercise with minimal to no pain, then you may be able to skip out on this. The final exercise in this video is the Bulgarian split squat. It was put last because it is the most difficult and least likely to be tolerated early on. This exercise is great for isolation of one limb by suspending the other limb up on a bench. It targets the glutes and the quads while getting support from other muscles such as the adductors. Start with no resistance in order to learn the form and then increase the load by adding weights. This line is a good guide for how to position your body from knee up through your head. As you can see, I slightly bend forward at the hips and my knees are close to my toes because of the large cushion in my shoes, as well as being very quad dominant. Here's form that should be avoided as it disengages the hip muscles and results in knee collapse towards the midline.